Hello, you are most welcome, ladies and gentlemen, to your power behind the voice on Tuesday Night Anatomy with Daniel Okwan. Yes, we are still in the era of anatomy of clinical importance. And my friends, this is today's case study. A 40-year-old man presents to the emergency department of a hospital with a 2-day history of erythema, and that's redness, of course, edema by way of swelling, and excruciating pain in, of course, the right nasal and upper lip areas. Yes, these, presentations were confirmed, yes, on physical examination. And this patient indicated that these presentations happened after he sustained a minor injury, yes, when he was playing with a friend. Now, based on the description, the doctor indicated in writing that this patient, yes, had, these injuries, and they were in the region of what we call a dangerous triangle of the neck. And of course, he also indicated the diagnosis and then the various treatments, yes, began. Now, these are the points that I want you to know from this case study. And so the first question I want to ask you is that, yes, the doctor indicated that he had an issue in the dangerous triangle of the face. And so what is this dangerous triangle of the face, and why is it so called? Now, the dangerous triangle of the face, yes, first of all, one thing that I want you to know is that, yes, by way of the boundaries, yes, what you have to know is that it's at the level of the bridge of the nose, okay, this area, okay, all the way till what we call the, labial commissures, or what we call the, the angular stomata. That's, of course, the corners of the mouth. So this way, okay, till this point, this area, okay, becomes, of course, the dangerous triangle of the face. And my friends, if you got, the case study right, it says that, there was that kind of, redness, the erythema, and of course, the edema, the swelling, okay, and of course, the pain were confined to this area, the right nasal, and of course, the, upper lip, this area. And so it tells you that, yes, this kind of, injury, or this kind of pathology is confined to, of course, the dangerous triangle of the face. And my friends, we are calling it as such for the reason that, yes, there's some kind of venous blood connections, yes, between the face and something that we call what we call the cavernous sinus, the largest dural sinus, which is located in the middle cranial fossa. Okay, that's important, and which I want you to become aware of. Okay, and what are these connections? By way of something we call deep facial vein. So there's, between the face and, of course, the cavernous sinus, okay, the venous blood connection between them is, of course, the deep facial vein. Okay, that's number one. And then, of course, we also talk about the superior ophthalmic vein. Okay, because an emissory vein. Okay, these veins, okay, communicate between the face and, of course, the cavernous sinus. Therefore, tells us that if you have an infection, yes, in the face area, okay, and there's, some kind of, breakage over there, there could be that connection. Okay, gets into a cavernous sinus, and we see all those complications which can arise from it. And so that is why we call it the dangerous triangle of the face. Now, the next question I want to ask you is that what is the clinical diagnosis of this patient's, condition? And my friends, your answer is cellulitis. Okay, cellulitis, or abscess formation, for the dangerous triangle of the face towards the right side. Okay, that's one thing I want you to know. Because whenever we talk about the cellulitis, one of the points that we want to understand is that there will be that kind of redness. The erythema will be there. There will also be that kind of, edema also over there. And no doubt that there's inflammation, and that is why there's that kind of pain, okay, that will be emanating from this area. Okay, so that's one thing I want you to know. Now, the next thing is that, assuming this kind of cellulitis or this abscess which has formed the dangerous triangle of the face is left untreated, what will be the complications? Okay, that's also one important point which I want you to become aware of. And so, my friends, the complications that will be associated with this is, my friends, there could be that kind of thrombosis, okay, to what we call the cavernous sinus. Okay, a lot of blood in there. Okay, this kind of, that kind of thrombosis, okay, thrombi may form in there. Okay, that kind of clot and all that may form in there. So thrombosis of what we call the cavernous sinus is one of the complications if this kind of cellulitis or this abscess in there is left untreated. And my friends, even it could lead to something we call meningitis. And my friends, in the worst case scenario, it could lead to an abscess formation in the brain. And so, my friend, the next question, where is question number 3 for you, is that, yes, what will be the causative organisms? So, which organisms are implicated in this cellulitis we are talking about? And my friends, the most important, the commonly involved, the commonest organism which is involved in this cellulitis is, my friends, Staphylococcus aureus. Staphylococcus aureus. That's one thing. But my friends, one thing that you need to also understand is that to a lesser extent, we could also have something called Streptococcus pneumoniae, can also be implicated in that regard. And yes, in the least case scenario, you may also have Haemophilus influenzae. Okay, so these 3 causative organisms, and I've said the commonest is, of course, Staphylococcus aureus. And so, my friends, the question therefore is, what is the approach? Once we understand that bacteria are implicated in there, then of course we know that antibiotics will be the best choice, okay, the best thing for us to, start, looking at the remedy, okay, the therapy. Okay, so the first thing that we need to do is that rather you're going to use the IV route. For the IV route, the bioavailability will be very high, and of course you want to get, maximum results. And so you begin with the IVs. That's what we do. Yes, it could be, this kind of penicillin or even ceftriaxone. Okay, so any of these antibiotics, and of course those ones which will be sensitive, okay, to any of these organisms, okay, that will be isolated, okay, that's the one we are going to make use of. So, my friends, this is the case study that, yes, I have for you today. I believe you find this helpful. I'm very grateful for your time this evening. Have a good night, all of you, and may the good Lord richly bless you. Amen.